The World Health Organization is now describing the global risk from the Omicron variant as very high.
The new COVID variant has been found in about a dozen countries so far.
President Biden is urging people to stay calm, calling the arrival of Omicron in the U.S. as, quote, inevitable. Meanwhile, doctors and infectious disease specialists are warning people not to let COVID fatigue set in. They're advising people to continue to take the proper precautions like masking and social distancing.
But I don't think we can just ignore this. We certainly can't ignore Delta right now, and we'll see what Omicron does. Burying your head in the sand isn't going to make them go away. Our way out of this is through vaccination. And so vaccinating the U.S. population is not enough. We have to vaccinate the world.
Omicron has more mutations than any other variant to date. That has scientists racing to nail down how infectious it is and how effective the vaccines will be against it. And those answers could take weeks.
We have gotten questions from a lot of you about that new variant, of course. Our Grace White is in the newsroom working to get you those answers.
These are all questions people have been Googling, looking for answers ahead of a busy holiday season. Here's what we learned from one of the top doctors in Houston.
It's the new word popping up in online searches as people scroll for answers.
We do know that travelers arriving in Europe from Southern Africa have already been documented to have been infected with this new Omicron variant. We know that this variant has been picked up in other places such as Israel and Hong Kong.
Dr. Jim Versalovic would know. He's co-chair of COVID-19 Command and pathologist-in-chief at Texas Children's Hospital.
What does that mean?
Last winter and early in 2021, we were dealing with the Alpha variant. So Greek letters have become standard with naming of the variants, primarily because we want to avoid stigmatizing particular countries or nationalities or regions just because the virus originated there.
Is Omicron more deadly?
We don't know yet. There's no evidence that it is causing more severe infections. I want to emphasize that. The story from Southern Africa now is that these infections have been generally mild.
Is this new variant in the U.S.?
It may be in the United States. We don't have any firm evidence yet. And that's speaking today, November 29th, 2021. So as we all know, this pandemic has been full of surprises.
Surprises they'll keep watching as we prepare to enter another new year with COVID-19. Grace White, KHOU 11 News.
Grace, thanks. Now let's look at some of the other coronavirus headlines this morning. Counting down from number 3, the White House is allowing some federal agencies to wait until after the holidays to fire employees who have not followed the vaccine mandate. An official called this a, quote, education and counseling period. Number 2, citing the emergence of the Omicron variant, the CDC is urging everyone 18 and older to get a booster shot. A booster can be administered 6 months after the second Pfizer or Moderna dose or 2 months after J&J. Which brings us to number 1 this morning. Pfizer wants to give its booster to 16 and 17-year-olds. The vaccine maker is planning to seek FDA authorization for its booster shot for those ages.